Hello, my name is Fatma Ahmed and today I will continue our seminar. The evaluation of high quality radiographs before surgery. If the opening to the sinus is small and the sinus is disease free, effort should be made to establish a blood clot in the extraction site and preserve it in place. Sutures are placed and the gauze pack is placed over the surgical site for 1 to 2 hours. The patient is instructed to use nasal precautions for 10 to 14 days. If larger perforations occur, it may be necessary to cover the extraction site with some type of a flap. The most commonly used flap is the buccal flap. Buccal flap, or we can name it elevating the buccal mucoperiosteal flap. A border-based flap with an adequate width to cover the communication with the margins of the flap positioned over the bone rather than directly over the defect area of the communication, as we can see here in the photo. The flap must be free of any tension. To accomplish this, the periosteum usually must be inserted and released at the height of the dissection. The oronasal fistula, delayed treatment. Elimination of any acute or chronic infection within the sinus. If the sinus disease persists, it may be necessary to remove the diseased tissue from the sinus using a Caldwell-Lock procedure. Careful evaluation of the adjacent teeth. The surgical steps of closing an orointral fistula. A fistula struck will be lined with epithelium that must be excised or elevated from the bony walls of the fistula, sutured together if possible, and inverted into the sinus cavity. Or we can use one or both of the following flaps. The buccal advancement flap. The buccal advancement flap, as previously described, one must remember that the osseous defect surrounding the fistula is always much larger than the clinically apparent soft tissue deformity. Rotations of the palatal flap. The advantage of this type of the flap is the large amount of the tissue can be elevated with a good blood supply. The disadvantage of this type of the flap, large area of the exposed bone result from elevating of the flap. The palatal defect will heal with granulation and secondary epithelialization, or in some cases it could be covered with temporary aperture and soft tissue conditioning liner. Elevation of a flap from the buccal and the palatal flaps. Large defect, particularly those resulting from surgical removal of pathological lesions, may be require large flap to accomplish closure and may include the use of pedicle flaps from the tongue or temporalis muscle. Sinus lift procedure. In the procedure that done primarily to improve the posterior maxillary alveolar base for secondary or stimulus endoosseous implant placement, as we can see here in the photo. Maxillary sinus tumors. We have two types, benign tumor and malignant tumor. To differentiate between the benign and the malignant tumor, we need to do a biopsy. The biopsy could take from where is transnasal or from the medial wall of the maxilla is the preferred route. Needle biopsy is sufficient. The biopsy via a Caldwell-Lock approach, اللي هي canine fossa puncture, is not recommended because of the potential to sear the gingivobuccal sulcus and cheek skin with tumor. The maxillectomy. Maxillectomy is the removal of the damaged parts in the maxilla due to cancerous tissue being present and damaging the hard palate. عندنا 3 أنواع للماكسيلكتومي. عندنا partial maxillectomy اللي هي hemi maxillectomy، وعندنا extended maxillectomy radial maxillectomy، وعندنا full maxillectomy. البارشال maxillectomy, part of the maxilla removed, leaving one or more bony walls in place, as we can see here in the photos. Total maxillectomy, removal of the whole maxilla, as we can see. وعندنا extended maxillectomy, removal of the surrounding tissue together with the maxilla as a result of the cancer. Surgery for the maxillary sinus tumors. عندنا Weber Ferguson approach. عندنا mid facial degloving. هاي صورهم as we can see. عندنا inferior medial maxillectomy والcanine facial resection، أو عندنا medial maxillectomy والradial maxillectomy with externation. Thank you.